Allergy is a very common word to be misused. Allergy progress with time.
Next generation is going to have more severe allergies.
Early intervention is extremely helpful.
Chronic respiratory disease is the second death causing disease in India.
There is something which can be detected by the tests which are very sensitive because these specific IgE will be there in your body.
What was that one incident or one episode when you realized that this could actually be an allergy?
I had dust allergy, pollen allergy. Any person who has allergic rhinitis, chances of going to allergic asthma is 80%.
Hello everyone, welcome to the Allergy Insight Show Season 2, your comprehensive guide to understanding allergies and allergy testing. In this special series, we are joined by leading allergy experts who will be sharing their knowledge and expertise on causes, diagnosis and management of allergies. From the latest advancement in allergy testing to practical advice for everyday life, we've got you covered. Stay tuned for more in-depth discussions and expert insights. We have with us Dr. Sunita, Dr. Vijay, Dr. Shilpa, Dr. Alap and Krishna. So I, as a child, was always known for my cold, and I've seen that transmit even into my older age. So I'm sure, doctor, you must have heard from many patients who think they have a cold that never ends. It lingers for weeks and even for months. So when do we start suspecting that it's not really a cold and it could possibly be an allergy?
So hi Jasmeet, and as you rightly said, if you are having cold right from your childhood, allergies are always transmitted genetically. There is an inheritance. So if a parent has any allergies, they obviously pass on to the kid, and now this is called as an atopy in medical terms. So most of the time the child is growing and he can start with some food allergies. He can have running nose, sneezing, itching nose. Many of the time the kids will be doing like this again and again because there is a lot of secretion. So this is what is called as a nasal allergy or allergic rhinitis. So what you were having was a allergic rhinitis. And how to differentiate it with infection? Most of the time, if you have a bacterial infection, you will have fever along with it. Viral infection will give you myalgia, body ache and all those things. But that will last only for 4-5 days or maximum a week. In allergies, it will be there throughout most of the time. Now, whether it is indoor, outdoor, this all depends on what you are allergic to.
Right. So doctor, like I said, I had a cold all the time, and I've noticed the same thing with my son as well. So Dr. Vijay, could you tell us if these kind of allergies actually run in families, and if one parent is sneezing through every season, should the kids also get tested early, or you think it will surpass with growing age?
See, most important is that the hereditary part has been already seen in allergic disease. So suppose one of the parent has an allergy, there are 50% chances the son or daughter will have it. And even if both the parents are allergic, so the symptoms can be anything. It may not be just cold or something. It can be a skin allergy. It can be the food allergy, even obstructive sleep apnea, snoring, to chronic respiratory disease also. So both the parents have the allergy. Then there are chances of around 75 to 80% their children will have it. So again, genetics has also changed because of the environmental factors and indoor and outdoor pollutants also. So the newer generation, the severity is more. So that's why in community problem is that most of the people feel my family there is a dust allergy, nothing to be done for that. It's not that way. As I said, the genetics has changed and the environmental factors. The potency of the allergens has increased so that the next generation is going to have more severe allergies. So even in an early stage, if the parent has an allergy and if the child has a hidden signs of allergy, we say, even the dark circles, denim organ folds or molar muscle spasm, long eyelashes. Then as Dr. Sunita said, the rubbing of eyes, ears and nose. Then excessive salivation during the sleep. Bruxism, like teething, the children do that. Disturbed sleep of the child. Then even the bad breath or protrusion of the jaw. Then upper caries of teeth. Then white coating of tongue is there. Then open mouth breathing. Even the children with a snoring, even repeatedly, some of the children have throat infections, tonsils, adenoids. So these can be even cervical lymphadenopathy. There are lymph nodes in the neck. So these are the early signs of child having a allergic inflammation or allergic changes. So if you can pick it up early and if you can test for the children in an early stage, they will have a few allergens. And there is a misconception to the community that most of the children, they will overcome the rhinitis or childhood asthma, but it is not that way. The symptoms will be overcome, but the allergy always continues. A new sensitivities, in spite of symptomatic management, And then they will later on in the adolescent phase or adulthood, they have more severe viral keratoconjunctivitis, sinusitis, ear problems, or asthma, adult severe allergies, even foods and drug allergies. So if we interfere in an early stage, we identify the test, we can better manage that. And there is a lot of misconception to the community that they feel like the children have a lower immunity and they will try to improve with some and cure it. But it's not that way. It is a hypersensitive disease. So by the testing, we can take some simple precautions and we can prevent these further sensitivities and further progress of the disease.
That's actually very insightful, Dr. Vijay, because we often assume that it will pass with time or my child will outgrow it.
That's a very big misconception into the community. That's why most of the families are fooled on that, and so many advertises are done that they will say that they will improve the immunity and they will cure the disease. It is a misconception. So proper allergy testing, identifying that, some simple precautions has to be done after the proper identification.
Right. So, Dr. Shilpa, that also brings me to the question that kids are constantly growing and changing. So, early detection, how early you think we should test them to understand what's changing in them and how we can actually help our growing children with their ever-changing symptoms, ever-changing causes that could be an allergy.
So start with the common misconception that the parents think that, my child will eventually grow out of allergies. But in reality, allergy progress with time. Those small sniffles and recurrent colds that parents usually often dismiss, if not managed early, the child might develop asthma and he'll become dependent on inhalers. This gradual progression is known as allergy march. So this term allergy march is basically the natural course in which allergic diseases progress in a child. So like in the beginning, the eczema and food allergy that happens in the early age, and then later it moves on to the allergic rhinitis and bronchial asthma. So a patient who is born with those harmless rashes in the infants that you ignore, this is probably the beginning of allergic march, and the child might turn into the asthmatic later in his life. So early intervention is important because it is proven in the scientific researches that with the early intervention we can halt the progression of allergic march and we can avoid the development of asthma in the child. So this intervention begins with the accurate and a standardized allergy test. Once we pinpoint exactly what is triggering those symptoms of sneezing, running nose, and breathlessness, we advise our patient how to avoid those specific allergens in their environment. And this information is very, very personalized because no allergy tests are safe, and even each allergy patient is different. It's not only help us to identify the allergy at that point in time, but you can even see how allergies are changing in a patient. So if you advise patient by just advising them allergy test in intervals, you can see if this patient is developing new allergies or if the existing allergies are worsening. Based on that, even in fact, the sublingual immunotherapy that is known to halt the progression of allergic disease is entirely based on the allergy test, the accurate allergy test. So allergy test is very important. So if they know how is it growing in the child, the intervention can be done, and early intervention is extremely helpful.
So, doctor, that's quite an eye-opener because just the previous season, my son catching a cold and I held myself responsible, our lifestyle responsible. I kept thinking, maybe we are not giving the right kind of food to the child. Maybe the immunity has worsened. That also brings me to the point that with so many things happening, lack of sleep, there is construction work going on, and there is pollution, there's a lot of chaos. So will an allergy test, Dr. Sunita, help me actually pinpoint the culprit between all of these things happening in our fast-paced lives?
So Jasmeet, you are absolutely correct. Everyone thinks that everything is an allergy. So allergy is a very common word to be misused in a local language and on a day-to-day basis. When we say allergy testing, we actually test the allergens for which a person is very hypersensitive, which a normal person will not be hypersensitive. So suppose you are allergic to something in the air and we walk into the air, you might start sneezing and I will not sneeze. So in allergy testing, we test the allergen, which is a naturally occurring protein in the nature. And when you say the triggers, like if there is dust, construction dust, there is pollution, some viral infection, all of them are triggers. So a person who is already allergic and has some subclinical symptoms and all, the time there is a trigger in the atmosphere, he will start reacting. For example, if this is my normal skin, if someone hits it, it doesn't cause me any pain. But suppose there is a deep injury here and it is totally inflamed and red and swollen up. So even if you touch it, you feel that pain. So similarly, a person who has a nasal allergy, when he goes into atmosphere which has lot of dust and pollution, he starts sneezing. So it is not that he is allergic to them, but they are acting as a trigger. So how do we differentiate is by taking a good history. When we talk to the patient, we take a very detailed history, how it started, where are the symptoms, whether it is indoor, outdoor, and which season it is. Many of the time, the pollen allergies are seasonal. A house dust allergy is a perennial thing which happens in the house. Every time you get up in the morning and you start sneezing. So how do we understand what is the culprit? We do a simple test called as a skin prick test, where we put the allergen drops on the hand, forearm, or the back, and we just do a micro prick with a needle. It's a painless process, it's a bloodless process, even kids do it very well. And within 15 minutes, the body gives you a reaction like a mosquito bite or a bump, itchy bump you get. And it's very easy to explain it to the patient when they see it on their skin. It is the same way when an allergen enters the nose or the lungs, you start reacting. And there's some other blood test also which can be done for the same allergy. But which test is best for you depending on your allergies? Meet a doctor, let the doctor inform you. Because there are many tests available in the market which are actually a not good quality standardized allergy test. People do it for various packages, but that is not the way allergy has to be managed. Go to allergy specialist, let the allergy specialist understand what you are suffering from, then let him decide what has to be done and then go for it. That will give you a very accurate diagnosis, and that is how the management will be done very well.
Right. So, doctor, like you explained, it's such a simple test to understand myself, what is happening inside my body better. And we don't even think about it. Like, sometimes I'm back from an event or back from a dinner and we have this unexplained rashes on the body. Sometimes we have itchy nose, absolutely unexplained. So what we tend to do is we just pop a pill or we just use a nasal spray and we think that's okay. Right. Never really thought that a test would actually help me understand what is going on better.
Yes.
So in such a situation, Dr. Vijay, if we continue to keep treating the symptoms, like allergy hai, I'll apply a soothing lotion, I'll pop a pill. If itchy nose, I'll just use a nasal spray. If one continues to do that and actually ignores the root cause, how do you think this is going to be problematic? What kind of problems can this lead to?
Yeah, absolutely. As you said, root cause. So most of the patients, they think the trigger is an allergy, like a dust after soaking into the rains, after eating some Chinese or any smoke, deodorant, perfumes, weather change or something, ice cream, cold drinks. So these are just triggers and irritants. And the primary allergens in the beds, the dust mites, then pollens are there, then funguses are there, a lot of molds we call it, the damp walls. Even with the vegetable and fruits also they can come in your houses. Then pests are there, the danders and all. Then insect droppings, dried feather, pigeon feather droppings. These are the primary allergens. So they will be sensitizing. So in spite of the symptomatic management, like as you said, the creams, nasal sprays, nebulizers, inhalers, even a lot of people in India, they go for homeopathic, Ayurvedic, so many alternative therapies, naturopathies and all. So symptomatically, they have a control. With some of the people, they have pranayam, yoga also. So the inflammation temporarily is controlled. But the allergy does not go with that. And the inside the body, like a leakage, the primary leakage is from somebody's bathroom basin. It will always continue. Temporarily put up some owning or some shade and all. Temporarily that leakage will stop. But the primary leakage will continue and then it will go on damaging your house. The same way in allergy, the primary allergen sensitization continues, inside whatever the inflammation continues, and then it will lead to the further more severe complications like allergy testing, identifying the proper, some simple precautions, and then long-term wise desensitization or allergy vaccines will only stop the progress of the disease. So we have to go to the root cause.
Correct. जड़ तक जाना ज़रूरी है if you want to solve any problem. Correct. So Krishna, coming to you as a patient, as somebody who has suffered allergy firsthand, what has your experience been like?
So as rightly said by all the doctors, that early detection is very much important. When I was a child, I had a small bout of asthma and then it was controlled, it subsided. But later on, when I went to London for my postgraduate studies, it was then when I had loop of continuous sinus infections which severely affected me. There was nose blockage, there was sinusitis, fever. And to control that, I used to take, pump, like the inhalers, the medicines. So it was symptomatic treatment. But later on, when I came back, the loop kept on going on. So discovery happened in London, and when I came back, it didn't stop till the time. It was in 2017 to 2023. And in 2024 was when I met Dr. Sunita Shukla, and I got treated for it. So I never knew that with symptomatic treatment, it did not go to the root cause. But after meeting Dr. Shukla, she explained me in detail about the skin prick test. I had dust allergy, pollen allergy. So based on that, I came to know.
So, what encouraged you to first go for an allergy test? What was that one incident or one episode when you realized that this could actually be an allergy?
Yeah, so for the symptomatic treatment, I used to go to a normal ENT, but when I had to go to Dr. Shukla, I had symptoms like shortness of breath, my ears was blocked. So those were the symptoms which kind of aggravated to an extent. So I had to go to an allergy specialist.
So I would like to add, she was also having chronic ear blockage, because if your nose are blocked, we have the eustachian tube connecting the nose and the ears. Those were blocked. So again and again, she was getting ear block, and she was having a constant headache, chronic headache for many months together. And she has even seen a MD medicine and a neurologist for it. All tests were done at this age. Imagine the trauma a patient goes through when you're doing ECG and ENG and all those things, and everything was normal. So then the question mark is, why is this happening? And that is the time we realized that this allergy, though you feel that it is only sneezing, running nose and some shortness of breath, it actually causes a domino effect. It starts with this, then you will get recurrent cold and cough, then you get a ear block, then migraine, headaches, and it's a whole plethora of things, never ending. So once we know the root cause, we treated her with the vaccines, and she is doing so good.
Yeah, since past 1 year with Dr. Shukla's treatment, I'm doing absolutely fine. Like the severity, the frequency has gone down considerably.
So, doctor, like you said, there is a certain stigma attached, with inhalers or with any kind of medication. So what happens is, there's one more thing that we parents end up doing, and that is opting for home remedies. We will, assume that a certain food group is causing an allergy. We assume based on our observation of the child, and then we cut that food group out completely. Or else we sometimes assume getting wet in the rain or monsoons causes a lot of sneezing, allergy and all of that. So we keep our child out of it. So now that we've understood how significant testing is, I also want to understand from Dr. Alap that do these home remedies or these things that we do from our side, we're only trying to help the child, but does this affect the test result?
So it doesn't affect. What happens is when you cut down certain foods or certain allergen exposure, your allergen levels, the specific IgE levels, that is something which can be detected by the tests which are very sensitive. They will be still able to detect because these specific IgE will be there in your body. It will be there in your system. So even if they are in the less amount, a sensitive test will be able to detect them. So stopping certain foods or stopping certain exposure to the allergens or some home remedies will not impact. However, we need to make sure that the medications which are given, certain immunosuppressants and everything, so those might impact the results of this test. And that's why it's important that when we do for the test, always consult, as rightly said, go to an allergist and take advice. And based on that, you can do a test which is actually required for the patient.
Dr. Vijay, like you explained to us, what is the exact flow of treatment? You first visit a doctor, understand what tests you have to do, and then come back to the doctor to discuss the reports. So once we have the report, is it a piece of information? Do we have to completely avoid what our reports have pointed out to? Or how does that report help you treat your patients?
Basically, because as I said, we always select exposure of the allergens and all clinical correlation. So once the report is there, then we identify how it is really correlating with the symptoms, the disease, or is there any false positivity or cross-reactivity. And then we guide the patient. What simple precautions can make a lot of difference. Suppose like most of the patients in the midnight or early morning will sneeze or they have a rash and all. These are because of the dust mites. And so dust mites are so much, like daily, we shed around 1.5 gram of our skin In 1 gram of skin, more than 10 lakh dust mites can survive. Suppose somebody is giving even oral steroids to control the symptoms, and so many dust mites is exposed. If you take as precautions on that, we can reduce the dust mite load. His symptoms will control, his medications will come down. It's like a simple, suppose a diabetic person is there and we are giving the best insulin. The same way, suppose this child which is going to the school and after coming back he is having a problem. So Pune में हमने एक study किया था, तो 65 children with asthma, we found molds into the bathrooms of the schools, a lot of funguses. So they are exposed to that. और जाते आते वक्त जो है बच्चे पोलन्स के साथ, तो simple mask after identifying the pollens, it will help the child a lot. So it helps her a lot after the test. इसीलिए इंडिया में इसका प्रॉब्लम क्यों होते गया, क्योंकि पहले जो ये कुछ भी टेस्ट करते थे ना और उसके जो फॉल्स पॉजिटिव रिपोर्ट देखे, पीपल कंफ्यूज होते थे कि मैं ये खाता था, मुझे प्रॉब्लम नहीं हुई है, लेकिन ये टेस्ट में तो रिपोर्ट पॉजिटिव आया है. लेकिन अभी ऐसा नहीं होता है, क्योंकि क्वालिफाइड एलर्जी स्पेशलिस्ट की वजह से हम वो टेस्ट करते ही नहीं है, तो फॉल्स पॉजिटिव के चांसेस ही नहीं होते हैं. तो सिलेक्टेड एलर्जेंस अगर हम करते हैं और उसका टेस्ट रिपोर्ट अगर हम इंटरप्रेट करते हैं प्रॉपरली, और उसमें जो नहीं अवॉइड नहीं कर सकते जैसे डस्ट माइट्स, पोलन्स है या पिजन फीदर, ड्रॉपिंग्स और ऑल, उसे हम डिसेंसिटाइज करके उसकी इम्यूनिटी है, स्पेसिफिक इम्यूनिटी एंटीबॉडीज़ बना के, तो वो टॉलरेट भी हो जाएगा और उसके एक्सपोजर के बाद भी उसे रिएक्शन नहीं होगी. तो फर्दर प्रोग्रेस ऑफ द डिसीज विल बी स्टॉप्ड एंड फर्दर कॉम्प्लिकेशंस आल्सो विल बी स्टॉप्ड. So this is a disease modifying therapy. So not only even the child, we have seen practically those parents which have flown to the outside areas, those who had a mild to moderate allergies, their children are having a very severe eczemas, food anaphylaxis and all. So it is transferred to the next generation also. So इसके benefits काफ़ी है.
जी. एंड डॉक्टर शिल्पा, अगर हम ये टेस्टिंग करें, सो दिस कैन हेल्प अस एलिमिनेट मेडिसिन्स कम्प्लीटली. इज दैट अ पॉसिबिलिटी?
See what happens, see, we are allopathy practitioner, and it's a chronic disease. So definitely in scientific researches, the efficacy is proven around 60 to 80%. But how these things are conducted basically in Caucasian population and all, but Indian population, we see around 90 to 95% difference in their symptoms. Introduction of the medication is core. This is how it is.
But Dr. Alap, there are so many tests that are floating around. They come as packages, and with fancy names. Honestly, for us to figure out which one is the most authentic one or which is the one we can trust, how do we figure that out?
So you should see whether the lab with which you're doing the test, is it accredited lab? So the accredited labs with NABL, CAP will always make sure that the quality of the test, the external quality assurance, internal quality assurance, all these aspects are taken care very well. Because even for a smallest test, it's very important that the reagents are correctly used. The right equipment is used. The equipments are calibrated correctly. And those will be made sure if you know that the lab is accredited and lab is following all the quality control measures. So all the good labs, you can always identify based on that and do your tests there.
Ma'am, like you said, polyallergy, I would like to share about my brother. Diwali ki safai ho rahi hai, he'll get an allergy. If somebody walks in with a strong perfume, he feels allergic. He takes out a blanket, it's of that furry fabric, he will get an allergic. We often say he's allergic to everything. So my mother says, no, he was a premature baby. That's why, ever since birth, he's been allergic to too many things. So ma'am, how do you help these kind of patients without overwhelming them, who supposedly are allergic to everything?
No, this is their perception actually. There could be 3 possible reasons behind it. So first of all, if I'll take this particular case, we can classify the allergens into indoor and outdoor allergens. So brother is actually reacting to the indoor allergen only, okay? And the most common indoor allergen is dust mite. So definitely if his symptoms are not seasonal, not outdoors, then chances are very high that he is only allergic to the mites. And the second, the possible reasons for this misconception is, the first is the unreliable allergy test, in which multiple things come positive, but it is not clinically relatable. First step is to look the credibility of the test and whether it is done by the standardized method. Second, patient can be actually polyallergenic. Patient might be reacting to multiple pollen at a time, but in that case, they have frequent symptoms and very severe symptoms hard to control. The third situation could be because of cross-reactivity. So many pollen share the common proteins. Like, patients who are allergic to the birch pollen, they come positive for the apple and cherries. But that is not a true allergy. It is because of the common protein that they share. So when we do CRD, we actually rule out this cross-reactivity. So patient is not on food restriction unnecessarily. Otherwise, they end up avoiding everything. There are no results. And what happens, it actually affects their social life as well. They go to the dinners and all and they cannot eat anything and they feel depressed, come back. And similarly with children, is school, a lot of discipline and all. And they then get malnourished because the milk is restricted, lentils are restricted, eggs are restricted, no enough protein in the diet. So we need to figure out this cross-reactivity and differentiate it from the true allergies.
So Dr. Sunita, like you said, prevention is better than cure. You said a stitch in time saves 9. So you think an early detection can actually help our children from diseases going to something very chronic like sinusitis or asthma?
Yes, you rightly said. Any nose allergy will eventually go into an allergic asthma. So it is called as one airway, one disease because the nose is a gateway to the lungs. Any person who has allergic rhinitis, chances of going to allergic asthma is 80%. If we diagnose it on time, we can stop the halt, especially by the allergy vaccines. If you treat the allergic rhinitis, you can stop the ear infection, sinusitis. Same thing happening what was in the case of Krishna. Her headaches was a cause of the allergic rhinitis. The best part is when you treat a young female with allergen immunotherapy, now science has proven that these good things will be transmitted once that female becomes pregnant. And all the good immunoglobulin which has been produced in her body will be transmitted through the, to the fetus or the newborn baby. And this is how we can actually stop the allergic march or the atopy, which we all are talking. Allergy is a hereditary disease. You can break the cycle. So this is one of the best treatment which you can give to the patient. So yes, understand, first go to a proper allergy specialist, diagnose your allergy, understand the root cause and treat the root cause, give benefit to yourself and to your future generation also. Because eventually the outdoor environment is not going to change. We have lot of pollution around us. We have so many coloring food, pollutants around us. The food addiction is so much. How do we stop the cycle? It is by enhancing our immunity for all these things.
This has been so insightful. Something as basic as an allergy test can actually change our lives to such a significant amount. We've really been overlooking something that is very, very important. Thank you so much for joining us on the Allergy Insight Show Season 2. We hope our discussion with the medical experts has provided you with valuable information on allergies. This awareness initiative is brought in collaboration with Thermo Scientific, providing gold standard blood testing solutions in allergy testing approved by major health guidelines. Parents, don't let allergies hinder your child's well-being and happiness. It's important to visit an allergist for accurate and timely diagnosis, which can lead to effective treatment. Ensure your child can thrive without allergy-related limitations.